Medical officials throughout southern Utah continue to closely monitor the COVID-19 pandemic. Administrators at Dixie Regional Medical Center in St. George say they're prepared because of emergency planning that was already in place. ABC4's Katie Crowlis reports.
Now, St. George is considered a high-risk population, with about 19% of Washington County considered elderly and a high portion of the population with comorbid conditions such as heart disease. And hospital leaders here at Dixie Regional Medical Center say they have to keep their foot on the gas pedal. Currently, about 2.5% of Washington County residents being tested are receiving positive results, a lower positive rate than the rest of the state, but hospital administrators say social distancing remains critically important to not burden their healthcare system.
Everybody has stepped up in a really major way. This is hard. What we're doing is difficult.
Dixie Regional's medical director, Dr. Patrick Carroll, says the hospital, which treats patients from Arizona and Nevada as well, has now implemented a new policy that requires anyone entering the buildings, from doctors to administrators, to have their temperatures screened before they can enter. The hospital is licensed as a 284-bed facility and can open additional beds at a moment's notice, including 40 more that are currently not licensed to use. They could expand several hundred more beds if necessary, and expect that they will need to expand.
Patients can be transferred down to St. George if need be. If our surge is later, we could transfer patients up to Salt Lakes.
Now, this facility currently has 32 beds in its ICU, with each having a ventilator, but the medical director says he could easily expand that to 5 to 10 times the amount of ventilators if needed. In St. George, Katie Crowlis, ABC4 News.